Testing, testing. Can you all hear me? No, I can't. There you go. You were muted. My background is not loading. Let me try that one more time. There it is. Can you guys hear me? Okay. What time is it? It's 11:08 a.m. We're a little bit late, um, but we're here. Today's update is going to be pretty quick. We just want to basically provide an update on where we are in the community on COVID with regard to cases. And Rebecca's going to be talking a little bit about long COVID today. And I think that will be all. Is everybody online? Thelma's on, Raylene's on, Claudia's on, LaDon's on, Rebecca's on, everybody's on. Okay. Good morning, everybody. Today is February 3rd, 2022. It is 11:09 a.m. And here we are today, this week, with our COVID update. So, the good news is that our COVID numbers are basically um, they're holding pretty steady with regard to getting new cases and people recovering and not having as much of a high case count as we did a few weeks ago. Currently, our active cases in the community are 10 active cases. Um, there have been 7 new cases in the past 7 days, or actually not in the last 7 days, but since January 31st. Um, that puts us at a total of 193 cases since the beginning of the pandemic within the Pueblo, with 183 sorry, that's wrong. 181 of those that have recovered. Um, we're still looking at the same testing opportunities within the Pueblo. We do have test options here in the HHS building, the medical building over here. If you need um, to have an opportunity to test, you can contact us on the COVID hotline. The COVID hotline is 505 Anyone that answers it can actually schedule you for a test or to pick up masks if necessary, if that's what you need. Um, but as of right now, that's basically what our current COVID status is in the community. Vaccinations are still being held at IHS by appointment only. Um, and there still aren't any mass vaccinations in the area that are available, but there are vaccines available at the local pharmacies, and there's one I think I don't know if Raylene, if you can, or Thelma, you can correct me. Is it Black Mesa or San Felipe on February 9th between 9 and 11? Sometime next week, you guys, if you want to get a vaccine in San Felipe, you can contact the IHS appointment line, which is 505-946-9203. But other than that, we have one observer out there. If you have any questions, please let us know. Really? You don't have your new camera up?
And I don't know, I think my computer needs updating again for the second time this week.
Do you all have anything to add? Eventually, we'll definitely respond to the update.
All right, I guess I will go ahead and start talking about long COVID, because it seems to be kind of a mystery to folks, including scientists and doctors around the world. So what we're finding out is that anywhere from being sick with COVID, hospitalized, dealing with really severe cases of COVID versus moderate to mild, also even asymptomatic folks are displaying symptoms of long COVID. And what they're now calling it in the medical community is post-acute sequelae of COVID. And essentially just what that means is after folks have recovered from COVID, they are experiencing a litany of symptoms after their infection. Some people are calling it long COVID or long haulers COVID, long haul COVID. So some of the studies that they have performed on groups of folks haven't had large sample sizes. So a lot of the data is somewhat preliminary, but I think that the longer that we go out from being in this pandemic, we'll find more and more information. Some important things to note are, again, that anyone can end up with long COVID. Anyone who's ever had a COVID infection, and even asymptomatic folks can run into this. So far, the studies that they've done have revealed that 80% of hospitalized COVID-19 patients are experiencing long COVID symptoms. About 5% of non-hospitalized COVID patients. And there are 4 factors that they're finding are in common, that everyone has in common with long COVID. You can have 1 to 4 factors, some have up to 3. One of those is type 2 diabetes. There's also presence of certain autoantibodies, reactivation of the Epstein-Barr virus, which is a lot of folks will associate Epstein-Barr with mononucleosis infection and a few other disease processes. Lastly, the serum levels of coronavirus RNA in your blood system and in the tissues of your body. So they've grouped the symptoms into basic groups. There's respiratory viral symptoms, gastrointestinal symptoms, neurological symptoms, and then some sensory symptoms, like when we lose our sense of smell, sense of taste, or something tastes different than it usually does. But that's not everything. The list is 2 pages long. There are a lot of cognitive behavioral pieces that aren't usually a factor in some infections, like brain fog, confusion, difficulty multitasking, irritability or chronic frustration or anger. Also aphasia, so people are not quite able to remember words in order to communicate and form sentences. Memory loss, anxiety, depression, malaise, where you just kind of feel not necessarily deeply depressed, but down. Some sensory things like weakness and fatigue, headache. the loss of sense of smell, loss of sense of taste, chills, sometimes blurred vision, subjective fever, which means you feel really hot, maybe you're even sweating, but you're not actually experiencing a fever. Lightheadedness or dizziness, muscle aches and pains and joint aches and pains. And this syndrome is affecting all of the systems in your body. So cardiovascular, you've got heart palpitations and low blood pressure or the development of blood clots. These are not as common in most folks, but they do happen. Your GI tract, having chronic diarrhea, nausea, vomiting, or abdominal pain. Also, respiratory. Many of the long COVID patients, people who are experiencing these symptoms, one of their primary symptoms is dyspnea or shortness of breath, having trouble breathing, having trouble getting deep breaths, cough, sore throat, and runny nose. So, people are wondering, well, how is this happening, or why is this happening? And what they're discovering is that long COVID typically tends to linger in blood and tissues in patients who are experiencing the symptoms, specifically in the gastrointestinal tract and also in the brain tissues. They have identified the spaces in the brain where they occur, and they are actually getting beyond, somehow getting beyond the blood-brain barrier. So other things that are causing this, people with high levels of the SARS-CoV-2 RNA in their blood early in their infection. But it's important to note that the level of severity of your COVID infection does not indicate whether or not you're going to get the long COVID syndrome. So you can have a mild case of COVID, and once you've recovered, you can experience these long COVID symptoms. And again, it's so important to know, even asymptomatic people, if you have a COVID infection and you feel fine, you don't have any symptoms, your body can still shift into a long COVID syndrome. And that's kind of scary, I think, to think about when you're thinking about the long COVID syndrome. It's something that we don't know when or how long it lasts. We don't know what the outcomes are after recovery. COVID goes into the body and it does damage to the tissues. It does damage to the cells. So it's really hard to know at this point what the long-term effects are going to be. Are there going to be permanent changes to your quality of life and any other variables that we haven't discovered yet? So how do we protect ourselves from getting long COVID? It's probably challenging at a statistical level, but things you can do that are so important are get all your vaccines, get vaccinated, get your additional doses or boosters when they become available to you, when you are eligible. It's so important to get those. They can't prevent it, but they can help prevent it. And that's the most important thing, is you need to do everything you can to prevent yourself from getting COVID and also prevent yourself from getting a long COVID. Wear your mask, wear an appropriate mask, wear an N95 is the best. Wear your mask correctly. I still see folks out in places where their mask has fallen below their nose. Your nose and your mouth are sources of aerosols and droplets. They both count. So if you breathe through it, put a mask on it. Wash your hands frequently. And lastly, eat healthy, sleep well, and try to get exercise. I know it's challenging these days. But those are all really important. You need to take care of your body and have it be prepared to fight infection if possible. And with that, I will turn it back over to Troy.
Rebecca, if we have two folks that are on, have any questions about long COVID, let us know. I was actually looking at a study the other day on long COVID. It was interesting. A lot of those things that you brought up were really, um, not just one study. It's studies all over the place that are coming back with the same risk factor. Type 2 diabetes is always in the top, three um, conditions that people have that put them at greater risk of having long COVID after an acute infection. But the one thing that some of the studies are coming up with is that metabolic syndrome, people don't know they have metabolic syndrome in many cases. And that is present in a lot of these cases where people um, are actually experiencing COVID symptoms, post infection. So, we in the diabetes program, one of the focuses that we have is trying to, um, reduce the severity of, prevent, uh, incidence of, and treat, diabetes, type 2 diabetes. But some folks aren't necessarily they don't necessarily meet the diagnostic criteria for type 2 diabetes, but um, they do have metabolic syndrome. So those are things that we definitely um, need to take a look at. And like Rebecca was saying, you can't necessarily prevent long COVID, but taking care of yourself and making sure you're looking at these risk factors. Being over the age of 65 is another one of those risk factors that puts you at great risk of developing long COVID. And if we look at the list of conditions that puts you at greater risk of having long COVID, it's the same list on the list of conditions that put you at greater risk of poor outcomes from COVID. So, if you think, it's all technically connected. And long COVID is not mysterious. It's not, um, sorry, I shouldn't say not mysterious because technically it is. The verdict is still out on what's causing it. What is really causing it. But it's not something to scare you, really. It's just something to be aware of. If after you have an acute infection of COVID and you start having these symptoms, neurological symptoms or gastrointestinal symptoms or all the different categories of symptoms that Rebecca brought up, it is important. That's why it's important for you to go see your primary care doctor from COVID, just to make sure everything is okay. There are long COVID clinics across the country working with people. Unfortunately, there's a long line, a long list of people who are waiting to treat physicians aren't necessarily know how to treat it because in order to treat things, sometimes you have to cause it. So it's still out there in the scientific community, trying to be understood. So I just wanted to say that because recently there have been a lot of studies that are starting to drop talking about long COVID and the incidence of and what the scientists are kind of um, hypothesizing um, around that condition. So it's still in the investigative process, but I'm glad that Rebecca was here to kind of give an overview of what it is because people are always asking about it, wondering what it is, and are they at risk or is it something they need to worry about? So again, if you have any questions out there, please let us know.
Yeah, I find the link to type 2 diabetes um, of interest because, even folks who have diabetes runs in the family sometimes. And if you're maybe pre-diabetic or you get very sick with COVID, if you have that, possibility, that genetic trait that it may actually activate that, So with diabetes, it's so important to help give your body extra protection, give your immune system extra protection, because you are more susceptible, especially when you get the flu, or even when you get a basic cold. It's harder to control your blood sugars, and high blood sugars. We know that does a lot of damage to the body on a chronic level. So I've even seen. I was looking. I think UC Davis, California, University of California, Davis, I guess. They have a long COVID clinic, and they had a gentleman speak about his experience with long COVID, and he has laminated notes that he takes with him, because he went back to his job after recovering from COVID, and he needed reminders of what to do. He was forgetful. He would not remember to ask the customer to pay the check, or he would misplace phone numbers for customers or items. And there was a real challenge for him in his interview. He even was at a loss for words at certain points. So it's very real. We just don't know all of the details about it. They are continuously unfolding to us.
I think we talked about this before, but there's a lot of evidence when people get COVID. One of the first organs that COVID goes after is the pancreas. If you understand, diabetes and type 2 diabetes, guess what? If you're at high risk of developing type 2 diabetes, your pancreas gets affected from COVID. Well, there are a lot of people that are coming out of COVID that did not have type 2 diabetes prior to COVID, and now they do, because their pancreas is affected. So they recover from it, they get better from COVID, but you develop type 2 diabetes, and now you have that risk factor that we were talking about earlier. If you contract COVID again, there may be a greater risk of poor outcomes. So being masked, vaccinated, keeping yourself and your family safe is definitely a need to focus on. So, anybody have anything else?
I do. Can you hear me okay?
Low volume, but we can hear you.
Okay. So my curiosity is when we're asking or talking to the community, I would like to know what the community feels about information that we're providing. Do you want information on, moving forward? There are a few individuals who have gone through difficulties, challenges, in regards to their health. I'm curious to know what is it you're looking from, for example, myself as a public health educator. What would you like to know? What information, are you seeking? Because we have health issues, and sometimes we don't talk about it. We don't talk about what's bothering us. My curiosity is, what would you like to hear from us? We're giving you information. Like a couple weeks ago, I provided that there are potential health benefits for those with post-COVID syndrome. It's the same thing Rebecca's talking about. What would you like to hear? What would you like to know? Because from my standpoint, what I've researched is that exercising can combat some of those illnesses that Rebecca's talking about. Increasing your heart rate, increasing that, allowing your blood to flow with that oxygen, those types of things, changing the way you look at food. Some of those are health benefits. What would you like to see? That's my question. So yeah, reach out if you have any comments or suggestions. We'd be happy to help.
Actually, I mentioned something earlier that some people may not know what it is. And I was talking about metabolic syndrome, and I should have been clearer about that, because I made the assumption that Metabolic syndrome is something that everybody knows. But basically, it's a cluster of conditions that puts a person at greater risk for developing conditions like diabetes and stroke, or having a stroke, or heart disease. And it's some people say that there's three conditions, but most people will say, if you talk to a lot of the cardiovascular doctors, they'll say that there's four conditions that you need to worry about. And they say conditions because some are technically considered diseases and some are not. So high blood pressure is one of them. Um, Obesity is another one of those conditions. Is basically excessive body fat around the waist, and hyperlipidemia, which is elevated levels of cholesterol and high blood sugar. So if you have that cluster of conditions, then you basically could be diagnosed, so to speak, with metabolic syndrome. And if you think about all of those conditions and what risk factors they can increase, you can just imagine if you're walking around with that cluster of conditions, um, you know, you can definitely be in a position where you're at greater risk of developing uh, long COVID, or having poor outcomes for COVID. So I just wanted to kind of clarify that. Do you have anything to add on that, Rebecca?
It's interesting that you brought it up because in my research that I've been doing recently, that was definitely something that was of concern. It's not something, I don't think it's something that they commonly see, though it definitely piqued my interest because of the typical, sorry about that, because of some of the health struggles that people experience across the board, all over our country, with elevated bad cholesterol, essentially, or low HDL, high LDL, having hypertension, high blood pressure, having an elevated fasting glucose. All those things. That's what makes these things so complicated, is that they're all different parts of your body are reacting to one scenario, and they're all reacting in different ways, and they're all negative ways. They're not able to positively correct the situation because it's an overwhelming cascade of symptoms. So in that way, actually, it's very similar to COVID itself, in that it affects your heart, it affects your pancreas, your insulin, it affects your blood pressure, it affects your cardiovascular system, essentially, but also your overall fitness and weight. These things, they all play into each other. Everything is interconnected, just like in all other nature. So it's really important for folks, if you have a family member or a friend who is, I haven't felt myself lately, or I've noticed that I've been taking my blood pressure and it's been kind of high a few times, encourage them to get seen by their primary care doctor, or nurse practitioner, whoever it is they see on a regular basis, and encourage them to talk about it more. We don't always want to focus on ourselves and our health, and sometimes we have our struggles with either eating well or exercising. I know for myself I do, and so it's really challenging to hold yourself accountable for those things. But there are resources out there, and folks who, like myself and my teammates, who want to help, and that's what we love to do. So that's what we're here for.
Any further comments or questions from viewers? Okay, so I want to thank everybody, Rebecca, for providing the information about long COVID, and everybody who's added comments on this topic. It is something that doesn't happen in such high percentages that we have to be really concerned or scared about, but we do need to be aware because some people have recovered from COVID in the community and have said weeks later that I still don't feel right. That's a clue that there might be something going on there, and you might want to contact your primary care physician. So, with that being said, Ladon, you have some presentations coming up. If you want to talk about those and give dates and times, that would be great.
Sure. I'll be providing a two-part series, a presentation regarding, we're going to look at heart health because this month is Heart Health Month. And so actually tomorrow we'll be gathering for health screenings here at the Senior Center. So just come on over. We're going to do a little bit of health screening, blood pressure checks. Rebecca will be here. I will be here, and then throughout the day, or from 8:30 to 10, we'll be providing informational sessions. You can meet with us, ask questions. That's the first part of what we're doing this month in February. And the 15th and the 18th, I believe, we'll be talking, or I'll be sharing a little bit of information regarding heart health, looking at heart anatomy, how the body functions, and just the importance of good blood flow, which is going to include nutrition education, nutrition information. And then the second part, we'll talk about strategy to be more mindful of what we're eating, what we're consuming, just information, a different approach instead of dieting. So when we think about dieting, we think about, not eating certain foods. We tend to label food as good and bad. So I want to take a different approach at looking at food differently and possibly thinking of ways to building a healthy relationship with food, because maybe we're not really realizing that food is nutrition. So depending on what we're consuming, it can go either way. We can look at eating food in moderation. We can look at food as an alternative, or looking at it from a different perspective, from a different lens. That's something I'm going to touch on in the second part of the presentation. But yeah, that's all. That's what I'll be sharing this month.
And Rebecca, you want to talk about the dental screenings coming up?
Yes. So on February 14th at 1, we are going to do a live stream with Janelle Trujillo, who's a registered dental hygienist. She comes from Rio Rancho and works at a large dental office. And so she's going to talk about children's dental health, how to encourage kids to brush their teeth and floss. And it should be fun. So, join us for that. She'll give a demonstration on correct brushing and flossing. And it works for the adults too. We all have teeth, right?
Absolutely. And do we have any other presentations coming up? Do you want to make sure we share or activities? I guess that is it.
Just want to
Um,
put this out there, just really quick.
Ready?
Tomorrow, when we, if you coming over to for your health screening, we have T-shirts, and then we'll also have a Santa Delfonso sticker that was created, and it's also wear red. So we just want to encourage individuals to think about their heart, wear red, and yeah, just support heart health um, tomorrow.
Okay. Hmm. I have a closet full of red, so I know I'll be able to participate and wear my red. Um, Definitely, we want to show the support. It's not just a symbol, just wearing red, but it's joining in solidarity with all the folks around the country who are going to be celebrating the same day, same event, the same issues. We have a lot of heart disease and different issues around the heart that kill a lot of our countrymen and community members, throughout time, and we want to do what we can to try to bring awareness to it and try to uh, help folks understand the importance of keeping the heart healthy and eating right and doing all those things that are necessary to keep us healthy as people. So tomorrow's Wear Red Day. Show up at the senior center. What time is it again?
Starts at 8:30.
Starts at 8:30. So come on over if you are interested in participating. Wear your masks, social distance, abide by all the COVID restrictions. We want to make sure we're safe when we're doing this, but come on over. More comments or questions? There are no comments, none in the chat. Any of the team have any comments? All right. It looks like we're all done for today. Thank you all, everyone who joined to view live. For those of you who are going to watch this later on, thank you for watching and getting this information that's important for us to understand and take in. And it looks like it's 11:45, and we are going to end at this time. And thank you all for showing up. Bye.